Hello, good afternoon. My name is Bart Morlion, and I will guide you this afternoon through the EDPM examination. Please, before we start officially, I want to remark that this webinar will be recorded. And this means that maybe also your questions will come up in the recorded version. If you do not agree with this, please leave the webinar. Otherwise, I wish you a good webinar. I'll start again for the recording purposes. Hello, good afternoon. My name is Bart Morlion. I'm the current president of the European Pain Federation, and I'm very happy to share with you some information and guidance for taking the EDPM examination. Let me check the slides. First of all, for those who are not aware about the European Pain Federation, or for those who haven't attended one of our meetings, let me explain briefly what we stand for and what we are. For those who attended already our meeting in Boston during the ISP Congress, this will be an edited version, so if you wish so, you will not hear that much new information apart from the guidance on the reading material. So what is the European Pain Federation? We're an organization of professional healthcare providers in the field of pain. We address research. We also address education and advocacy work. And this is, these are the three pillars of our activities. On the picture, you see the representatives of 37 chapters who are member of the European Pain Federation, and maybe you will notice one of the people from your country. So we represent over 20,000 healthcare professionals. We recognize pain as a biopsychosocial phenomenon, and we're a multidisciplinary organization, not only represented by physicians, but also by allied healthcare professionals, such as physiotherapists, nurses, clinical psychologists, and all types of allied healthcare professionals. Let me focus a little bit on our educational initiatives. It's a very strong pillar of our activities. Maybe you are aware that we run the European Journal of Pain. It's our major scientific publication. And if you are a member of your national chapter, you're entitled to have a free subscription. So check this, please, on our websites. We do have pain schools. You can apply also for grants for our next pain schools. Please check our website. And then, importantly, we do have our biannual flagship meeting, the Pain in Europe meeting, which will be held in the city of Valencia in the beginning of September 2019. And this will also be a very exciting meeting where you will be able also to follow refresher courses during the meeting apart from the scientific program. And that's the reason we're gathered here together this afternoon. We run and prepared a curriculum, and we run diplomas and examinations in the field of pain medicine. At the moment, we have a diploma in pain medicine for physicians, but we also have in place a diploma for physiotherapists, and under preparation are a curriculum and examination for nurses and for clinical psychologists. Furthermore, we do have an e-learning platform with many interesting lectures and contributions during our pain schools and pain fora and pain meetings. And you can find these on our websites, and this will be free. Let's focus first on our core curriculum for the European Diploma in Pain Medicine. And if you had the opportunity to visit one of our booths, you will notice that we shared with you this document. It's a nice booklet, and it's one of the most modern curricula in the field of pain medicine. And we are very grateful to our colleagues from Down Under that we could use their curriculum from the Australian New Zealand Faculty of Pain Medicine as a basis to create our European curriculum. As you noticed, we also have prepared curricula for undergraduate students and also for physiotherapists. We created this curriculum because there was a strong need for recognition of activities in the field of pain medicine. And in many European countries, there are no dedicated possibilities to qualify in pain medicine. Although we know that in some countries, pain medicine has been recognized as a known subspecialty in its own right. For many other countries, there is no structural education in the field of pain medicine. So looking at 37 different European countries, there is a huge inequity in the system in regard of the pain education of healthcare professionals. And that's the reason over the last years, the diploma, European Diploma in Pain Medicine was created. We had our first examination in the city in Spain, in Madrid. It was in 2017, and we had during the first examination we had almost 17 successful participants who got the diploma in pain medicine. If we look at last year, we had a second edition of our examination at the University of Leuven, which is located very near the airport of Brussels. And this was also the first edition of the EDPP, European Diploma in Pain Physiotherapy diploma. It was held in the skills lab of the medical school in the city, at the University of Leuven. Sorry. If we, I want to give you a brief overview of the format of the examination, and that's the reason you're probably logged in. And I noticed that 37 people are watching this webinar. This is great. And so very briefly, what is the purpose of the EDPM? It's to improve the standard of pain assessment and treatment through the provision of a qualification for all medical professionals that test their broad understanding of all types of pain and their treatment. So to be clear, it's not only focused on chronic pain, it includes also cancer pain, it includes also acute pain management, and that also in different types of patients, going from neonates, children, adults, and the elderly patients. The content of the examination is based upon the European Pain Federation curriculum for the European Diploma in Pain Medicine, and from now on I will abbreviate this as EDPM, and this is the curriculum. For those who do not have a hard copy at the moment, please check our website. You will find a PDF version of this curriculum. It's freely downloadable and you can use it in print or on your computer for preparing the EDPM examination. Importantly, we also provide you with a suggested reading and reading list, and I'll come back to that reading list later on. The examination itself has, or let me focus first on the curriculum. The curriculum is a very modern curriculum. It's built upon the CANMET model, and the CANMET model means that we, as a medical expert, as a good clinical expert in pain medicine, you have to be not only have a good knowledge on pain syndromes, on the physiology and pathophysiology of pain, but you need to be also a good communicator, because communication, especially in pain management, is very critical for a good response and a good efficiency of your therapy. You need to be a collaborator. You need to be able to collaborate with your peers and with all different types of healthcare professionals. You need to be a manager. You need to be a health advocate. You need to be able to translate also your knowledge towards a broad public, to lay public, but also use your skills and expertise to advance pain medicine in your country. And you need to be a scholar and a clinical expert. So these are the different areas where you have to excel if you want to call yourself a clinical expert. And around this, starting from the CANMET models, several topics are discussed in the curriculum. The foundations of pain medicine roles in practice, focuses on these different CANMET models, essential topics areas, and this is more content, and then special patient populations, like for instance elderly, like for instance very young children. These are just some examples. Let me guide you through the next section, which will deal with the EDPM, the format, and the examination itself is composed of three parts. First of all, you start with a multiple choice question examination. Secondly, an objective structure clinical examination, and we abbreviate this as OSCE. Yeah? And then Viva examinations, meaning that you will be interviewed by examiners. Let me give you some more details on the MCQ paper. The MCQ paper is composed of 50 questions, and each question will be composed of a stem followed by 5 answer statements. Each answer statement will either be true or false. So it's true or false. There will be no negative marking, meaning that if you have answered one of these sub-questions wrong, we will not deduct any marks of your total score. You will get 90 minutes for taking this MCQ paper, and our previous 2 editions of the examination learned us that this is time enough to finish this paper. The second part will be the OSCE, and I repeat, OSCE stands for Objective Structure Clinical Examination. I'm aware that in several countries in medical schools, these are not installed yet, or are maybe you studied many years ago and you have never witnessed or participated in OSCE examinations. For those who studied over the last, or finished their medical school over the last 10 to 15 years, probably they will have encountered also OSCEs during their final examinations. What are OSCEs? OSCEs, the system of OSCE is actually a modern type of examination often used in health sciences to test clinical skill performances and competence in skills such as, for example, communication, clinical examination, medical procedures, prescriptions, exercise prescriptions, and so on and so forth. And it runs through either real or simulated patients, and these we abbreviate this as SIMPADs. And these are actually actors. They will have a screenplay and they will play a patient, or by, for instance, a patient file. So it's not always a live actor or real patients, or for instance, by getting a file with medical imaging, with lab results, and so on and so forth. So a very simulated situation which you can encounter during your clinical practice. One of the ways an OSCE is made objective is by having a detailed mark scheme and standard set of questions. And I'll give you some more information on this. So if we look at the OSCE, how we will organize it during the EDPM examination, there will be 6 stations. And you can translate this as 6 rooms, each representing a clinical situation related to pain medicine. And the participant is standing before a door. There will be a bell. You enter this room, and then you will be confronted with a clinical situation. Depending on the situation, you can read already some background information on the door. So you have some knowledge, and I'll give you an example afterwards how we do this practically. Then you have 7 minutes, and this is quite long because, for instance, in national examination, often this is only, this time period is only 5 minutes, but because of the language barriers we sometimes encounter, we decided to increase this to 7 minutes to complete each station. And then you have a short break, 1 minute, shifting from one door to the next door between each station. So it's a very intense but very concise way of examining. Each station will be marked using an examination paper by an examiner who will attend the station but will not interfere with you. So he or she will only observe if you how you perform. For instance, your clinical examination, if you put the right questions, if you propose to your patients a differential diagnosis, and this is very structured, just marking done or not done, and this will give the final mark for each station. We are at a medical school, and it will be held in a hospital clinic setting with individual rooms per station. And then we will have the Vivas. And the Vivas means that there will be an oral examination in which the participant is asked to engage in a dialogue with at least 2 examiners. Mostly, so the format is that one examiner will interview you and the second examiner will mark you. We increase the possibility for the Vivas to giving you more time to elaborate on your answers and your cases, and to reduce eventual problems of the language barrier. So there will be 4 Vivas, each lasting 10 minutes, and in fact there will be 2 places, each with 2 examiners who will switch from examiner to observer, giving you in total 40 minutes, in Viva examinations. 2 of these 10 minutes will be based upon case histories selected from 5 cases you submit yourself. So the participant submits 5 real-life cases you encountered during your clinical work over the last months. The other 2 in Vivas will be based upon a typical clinical situations designated by the examination committee, and these will be the same for all the participants. So once again, this is held in a teaching hospital setting with individual rooms per station. So not in big rooms where you can see your peers examined. You will always encounter 2 examiners. So no examination by 1 examiner in 1 room. Let me shift to the next point. Most of you will be interested how we mark and grade. The final marking will be based on grading levels, and 4 grade levels will be established by the examination committee for each feature. You can have a pass with distinction. We're very satisfied. You really had a brilliant examination. You can have a pass. You had a proficiency in your knowledge and skills. Yellow flag means there were some caveats, and we have some doubts about your answers, and you weren't able to fully satisfy the examiners. And a red flag is actually you didn't pass on this part, and a red flag can be can have a negative influence on your final mark of the examination. Any participant receiving 2 yellow flags or 1 red flag will be deemed to have failed the examination as a whole. So to give you one example, you could pass, if you have MCQ passed with distinction, you passed your OSCE and you have a yellow flag on the Vivas, you will pass the EDPM. However, if you would have a red flag on your MCQ, you are not able anymore to pass the EDPM. The exception of this grading system is the marking of the MCQ, because we do not have a guessing correction, meaning negative marking, meaning that you have to get at least 70% of the answers correct to pass the MCQ examination. I want to stress also that we give a prize for each year for the participant who has received the highest grades during this and the highest markings during the examination. And the participant with the highest mark in any given exam year is awarded the Ulf Lindblom prize. For those who are not aware, Ulf Lindblom was a professor who founded the European Pain Federation, and in honor of our fathers in the European Pain Federation, we named the prize for the best EDPM participant examiner, the Ulf Lindblom Prize. The prize entitles you, if you win them, this prize for a free registration and costs at the Congress at which they are presented with the prize. So in this case, the winner of the prize and the participant who has the best markings on the 12th, 13th of April this year will be invited on our costs to receive this prize at our meeting in Valencia. What about 2019 examination? Here are some organizational details. So you will be aware that we have set a date at the 12th and 13th of April 2019, and we will start on the Friday afternoon, and Saturday we will do examinations on Saturday morning. So Friday afternoon, Saturday morning, giving you the possibility to reach Brussels also on the same day and get out the next day to reduce costs. The location will be at the medical school of the University of Leuven. It's very near the National Airport of Belgium, which is Brussels Airport, and there are many cheap flights coming in to Brussels. The fees are €700 plus VAT. As indicated, we have a lot of low-cost flights from most European countries available, so check your flights in timely. And we do have low-cost accommodation available in Leuven and Brussels and near the airport. The registration is open until the 30th of March, giving you still some opportunity to make your decision if you want to take our examination this year, and I encourage you. However, if you want to be entitled for a bursary, helping you financially to take the examination, we have bursaries available for 30 registrants, and there is a tight deadline for bursaries on the 10th of February. This deadline will be reached. So this gives you only about 14 days to take a decision if you want to apply for a grant. So I encourage you to finish and complete your registration and then apply also for a bursary, which will enable you and will dramatically reduce also your costs in taking our examinations. Because of the intensive form of our examination, not an MCQ, because we can run an MCQ in a big room, but we have a very intensive examination system for the OSCEs and in Viva. There is only a limited number of places available. And I can share with you that at this moment, there are still places available, and we still have a few places available for applications for bursaries. How to register? Please go to our website, and you will find in the pull-down menu very quickly also a link to the registration system. We noticed that many of you, and also who are participating here in this webinar, started their registration but haven't finished it yet. So if you want to get financial support, please do not wait until the 10th, after the 10th of February. For those who will wish not to ask for financial support, you still have time until the 30th of March. And then, of course, you're very anxious to know, could we have, are there some questions we could see as an example, or what has been done during the previous examinations? I do have some examples, very few, to share with you. This is an example of the format of a typical MCQ question during our MCQ examination. And you see there is one statement, and to be clear, the layout is the same as I'm showing to you. The following is important when diagnosing complex regional pain syndrome, some CRPS. And then you'll notice that there are 5 statements. There should be an inciting event and a timely connection to it. Patients who have severe pain early after trauma are at risk. Spontaneous CRPS is common. CRPS can affect the head and torso. MRI and plain X-rays are needed for the diagnosis. And then you can tick a box, true or false. And just to give you a flavor, this is the way this question should be answered. To be clear, each category here, or each sub-question or statement, gives you 1 point if you answered this correctly. So it's not, you do not need to fulfill or have all questions right to get this 1 point. No, it's by marked by statement. A second example of a MCQ question: in a neurological assessment of a patient with chronic pain, the following terms are referred to as negative sensory signs or symptoms: paresthesia, hyposthesia, decreased vibration sense, thermal hyposthesia, impaired proprioception. And then this would give this answer. So paresthesia actually is a positive sensory sign, and this symptom, and this would be the correct answering of this question. Let me give you an example of an OSCE. Oh, sorry, this slide went back. For instance, you are standing before a door, and on the door you get these instructions. The topic is communication on low back pain. So that's what you will be examined for. This is not what you will see. You will see the following text. Mr. John Smith is a 43-year man who has attended a pain clinic today complaining of low back pain. Please take a clinical history relevant to his complaint. No examination is required. So this is about communication and history taking. That's the focus of this OSCE station. And the examiner will observe you while you interact with the SIMPAD, with an actor. For instance, checking if you introduced yourself, if you asked for age, occupation, if you asked for the history of an inciting event. So, and during these 7 minutes, almost 20 up to 25 different topics will be checked if you are asking the right questions, and also about the attitude and your communication skills towards the patients. And the observer will only mark if this is performed correctly. If you didn't forget, for instance, let me see on the next slide is an example. Did you check for past medical surgical history? Did you check for a medication, for previous surgery? We blended on purpose some of the possibilities and points, marking points, because this is one of the active OSCEs at the moment. And then, very importantly, you should check for red flags, and that's the reason this will mark with a 2 and not with a 1. So, and this gives you a total score on 40, and in this way we're guaranteeing you the most objective clinical examination as possible. What does the SIMPAD patient get as background? So they're trained, they know what to answer, and they get lists what they have learned, their script. They know that it's will tell you that it started 6 weeks ago, but you have to ask for it, and it started after lifting a heavy weight. If you ask what activity caused your pain. So this is an example. So there is a very detailed guidance for the observer, the examiner, who will not ask you questions. He will just observe you. And there is a very strict guidance also for the SIMPAD. And the SIMPAD will not mark you. It will mark you only on the communication skills in general, but the final marking will be done by the observer. Finally, How should you prepare yourself for your examination? And this is a question I got almost daily from people who are interested to take the examination. First of all, if you are a skilled pain physician working for 10, 15 years, really in a pain center, in a multidisciplinary center, spending at least 2-3 days a week in pain medicine, your preparatory work will be very limited. You will not need much extra work to prepare for our examination. However, if you are a very young doctor who just finished medical school or is still in training in specialty training, probably this will depend on how many months and years you spent already in pain medicine. And in that case, you will need some good preparatory work to take our examination. We have prepared some guidance, which is shared with you on our website. And new from this year, a few weeks ago, we put online recommended reading list. I'll come back to the reading list immediately. We think that the refresher course syllabus 2018, that means and I can show you the booklet, the refresher courses. It contains summaries of all the refresher courses given during the World Congress in Pain in Boston in October last year, and it's a very good introduction to pain medicine, and so we recommend also this book to prepare our examination. You can get this by ISP Press in a hard copy, but it's probably delivered. It will take some weeks. There is, however, also an e-version available on the ISP website. You can subscribe to our EFIC education platform for video lectures. You will find part of our previous refresher courses given during our Copenhagen meeting in 2017. But you also will find a lot of educational videos on a broad array of topics given during our European pain schools, our EFIC pain schools. For those who are still in doubt or decided already, I will await the next edition. There, I can recommend you to attend the refresher courses at the EFIC meeting in Valencia. For the first time in the history of the European Pain Federation, we will organize a complete track of refresher courses. We increase the number of educational refresher courses, and you will be able to follow all the refresher courses. So there will be no parallel sessions. There will be only parallel sessions with the other scientific program. So it will be possible to come to Valencia and to follow from morning until dawn all our refresher courses. And that would be one of the nicest studying elements to prepare yourself for the EDPM. Coming back to our reading list, please notice that the reading list is a dynamic document, and we are fully aware that we still have white spots, but we try to identify on many topics in our curriculum already very educational and updated, very recent review papers on the matter. Most of the papers we identified are available in open access. So if you click the link, you will get access. However, we regret that it's not possible to do this for every paper, and we cannot distribute papers, of course, because of copyrights. For some of the papers, you need to log into your institution, and most of the people who are interested in taking our examination do have access to universities, to hospitals. And if you do not have direct access, please ask in your network, ask for other colleagues if they can provide you with a copy of these papers. Please be aware that we will update also before February the 15th, this reading list. So there will be an increase in the number of papers in this list, and we acknowledge that for some topics there are still some white spots. However, it's important to take a good look at our reading list, because, to give you one example, we have already created a huge bank of MCQs questions over the last years, but we will create at least 50% new questions, which will mainly, for the majority, come out of these review papers. So to increase your chance to have a good focused prep of this examination, I really recommend you to have a very good look and study the papers which are acknowledged in the reading list together with the refresher course syllabus. So I cannot stress this enough. The reading list is also key for taking the examination. Let me check. I think I talked now for exactly 40 minutes, and I'm quite sure that there will be a lot of questions from your side. So I'll open now the question platform, and if you're looking at your computer screen, you would be possible, you should see a box where you can put in and raise your question. Let me first check. We already got some questions. Has the number of case reports been increased from 3 to 5? We ask for 5 case reports, and unless my memory doesn't confuses me, we asked already in the previous editions for 5 case reports. So this is not a change to the previous editions. So 5 case reports. And the case reports is a good entrance. So you have a chance to, we encourage you to have different case reports. To give you one example, it won't help you if you bring in 5 different case reports dealing only with CRPS, for instance, or dealing only with patient selection for a neurosimulator. We want to have a good variety in the cases you present. I'm looking at the next question coming from Salim. What do you mean by prescription and exercise? This is just an example, because it's just a description of what an OSCE is. We will not ask you to give a written prescription for a drug, because there are too many different national differences in the way of prescribing. No, this is just an example. What might be possible is that you will find some MRI, for instance, or a CT scan. You will have a light box, and we will give you also some clinical information and some lab results, and we will put you some very structured questions. That's a possibility. However, do expect also SYMPAT patients. There will be people in the room who will play a patient, and you have to address them just like you do on a daily basis in your daily clinical practice. Let me check. Somebody's concerned about drug names, and we fully agree that there can be, we will never use brand names, because brand names are very different between the countries, we notice. So we stress that you should, in the Viva examinations, please try to use only your pharmacological names. To give you one example, if you want to discuss pregabalin, talk to us about pregabalin and not about Lyrica or another brand. So we are aware of this problem, and this is not something which will lead to a fail because you're using a different name. For instance, in Europe, mainly paracetamol is used as a term, but we are aware that some people are used to use the term acetaminophen, and this will not lead to fail. That's clear. There are many questions, so I will move on. Is there any obligatory practice time before attending the exams? At this moment, it's not. However, if you've never worked in a setting addressing pain patients, and I prevent the word multidisciplinary pain center on purpose, because over the last 2 years, also people who were not part of a multidisciplinary team passed our examinations. So you should have some clinical experience related to pain management, but it's possible that your field of expertise is more dedicated to the perioperative setting. However, on a theoretical level and skills level, you should be able to address also chronic pain problems. So in the end, the best chances to have a successful pass of our examination would be, for instance, somebody who just finished or is in training in pain medicine, finished already a fellowship. These are the ideal candidates to take our examination. We do not focus only on medical specialists. Let that be clear. Also GPs with a special interest in pain medicine, surgeons, neurosurgeons, physical medicine, rehabilitation doctors, psychiatrists are welcome to take our examination. So at the moment, there is no obligatory practice. However, we ask a written statement of the director of the place where you worked up until now. Let me check the next question. In OSCE, what medical procedures we will perform? Is it just an examination? Okay, this is probably focused on the question, will you have to prove, for instance, proficiency in performing interventional pain procedures? No, this doesn't make part of our examinations. We do have internationally acknowledged examinations in place who focus on interventional pain procedures. However, the level we expect is that you would be able to put forward the indication to refer to a specialist who has a special expertise in interventional pain management, and you should be able to tell your patients what might be the risks of, for instance, certain types of interventions. But we will not confront you with a cadaver of or a model where we will ask you to perform an ultrasound or radioscopic guided intervention. That's not the focus and the aim of our examination. So to know the diversity of techniques and the possibilities of these techniques, yes, this makes part of the examination, but not the procedure itself. Do you need to carry out neurological MR for checking the reflexes? It's possible. If there is a general clinical examination, we will provide you with the material and an orientating neurological examination. And let's remember that, for instance, neuropathic pain is makes a large part of the work of a pain physician. You should be able to detect this, and an orientating neurological examination makes part of a possible clinical examination. So yes, this is something which might be asked and might show up also in an OSCE examination. Where can we find more MCQ examples? At the moment, I regret, I'm not aware, I'm not on Facebook, I'm not aware if there are already blacklists circulated with people who remembered our questions. At this moment, we do not share previous MCQ questions. However, there are some examples of American MCQ examinations. However, I want to stress immediately that mostly these are dealing also with interventions, and that's not a part we're dealing with on a technical, from the technical aspect, but from the aspect of the we do focus us on the indications and the broad lines of the complications. Let me see. Is the examination for physios at the same time as the medical? Yes, we will. In the same building, there will be parallel examination of the physios. It's not a mixed examination, so you will not enter a room which would be the same room as for the physios. I hope this answers your questions. Then, is there a need for a recommendation from form? Let me read this question. Need for a recommendation from another, but if you work in a small clinic, may be difficult to get a recommendation. In that case, I imagine that every one of us has a boss. And if it's not a program director, if it's not a professor, then at least if you work in a small setting, small hospital, there is a medical director, and you can ask the medical director for a recommendation. Yeah. So we really want to have some written statement stating that what you put forward in your online registration, that we can verify some aspects of it. Then, okay, I expected this questions. It's a little bit confusing. I do admit that it's very confusing. There are at this moment 2 versions of the EDPM with the same abbreviation. The EDPM examination of ESRA. For information on that examination, you need to check the ESRA website. It's an anesthesiologically focused examination. And if we compare the aim of our examination, has a much broader scope and a broader field of pain medicine than exclusively anesthesiologically directed examination. And by my knowledge, there is also more focus on the typically anesthesiological interventions. Okay, so I answered the next question already. So if you're really not part of a group of pain physicians, or you hadn't the opportunity to follow a fellowship, then you can provide a written recommendation of the hospital director. EFIC states, is it on our website? We should check this. I got a message here that it states 3 case reports.
Should be 5.
Yeah, we will check this, because I noticed that there is some confusion. And we will check this. I'm looking over my webcam now to Sam Kinman, and our executive director, who will get back to us within a very short time. Okay. Okay. Somebody, yeah, you copied 3 case studies. So I must apologize. There must have been some confusion. Is it?
I'll have to check. I can't recall the exact details.
No, somebody here copied already this from our website. Of course, we had within the examination committee, this was a topic of long discussions, and there was a discussion about 1 case report, very elaborated, up until 10 very short case reports. And I remember that we narrowed down the discussion to 3 to 5 case reports, and we will stick to what is communicated at the moment on our website. Okay. We'll focus on this. So we'll give some extra information on our website to stress the exact number of case reports required. I'm very sorry for this confusion. And then let me check. Okay. question. Review papers and reading lists to prepare about spine problems. There are already a few of these papers in the reading list at the moment. There is a chapter also in the refresher courses, and probably there's some paper will be added before the February the 15th. Of course, if we look at recommended reading list, we focused also on the very general accepted guidelines, international accepted guidelines, and one of these guidelines, most recent guidelines, are the NICE guidelines from UK. Is the exam appropriate for a physio in private practice? If you mean physio, now I'm a little bit confused because the word physio is used in different countries in a different setting. In some countries we do have physical medicine and rehabilitation medicine, and these are physicians. Then I would certainly say yes. The EDPM is really also focused towards physical medicine colleagues. And to give you one example, in Belgium, physical medicine is very involved in multidisciplinary pain centers, and many multidisciplinary pain centers are staffed already also with physical medicine colleagues. However, if you mean physiotherapists, then I would highly recommend you to have a look at the EDPP, and there will be a webinar also focused on EDPP. The non-physicians are not eligible to take part of the EDPM examination. Two main differences in information provided in this very nice. Okay, thank you for the nice comment, but I noticed that indeed we have this discussion of the 3 or 5 case reports. We're still checking, and maybe we state 5, but there may be some discrepancy that we need to. Yeah, we'll check. We'll check, and we'll give the final. And if over many weeks this has been communicated for 3, we will check this. Then we will follow the direction which was given on our website. Then, there are still questions coming in. Let's hurry up. Is there a chance for a mock one day ahead? Okay. We know that this would be very helpful. However, we didn't manage to organize for this edition. However, it's on our agenda, and we acknowledge that it would be very helpful to do a mock examination. There was also the request to do a prep course, but based on the number of examiners we have to fly in from all parts of Europe and even outside of Europe, this was not manageable for this edition. So thank you very much for supporting the idea, and we will take it on board and discuss this during our next meeting. A fee of 250. I think you are looking at the EDPP website, and this might be the difference between EDPM and EDPP. The fees are different for non-physicians than for physicians, and also the case reports differ from EDPP, which is for physiotherapists, and from the number of case reports for the physicians. So that would mean that we didn't make any mistakes, that for physicians, we stick to the 5, and now we have the solution already to our problem. There is a difference in the number of case reports for EDPP and EDPM. So with prior, okay, yes, it's possible to take, there is a question if there is a possibility to have some interaction with one of the examiners or with us to discuss if your background is enough. Yes, I allow that there is some contact and maybe a call to discuss, your background if you're in doubt to register for our examination. So please contact our office, and they will lead it to the chair of the examination committee or to one of the members. And this is one of the questions I might handle myself over the next weeks. Then, how long or short have the case reports to be? Yes, in fact, we will not have the time to elaborate and to check all the case reports. So a case report with 10 pages, full pages, is far too long. Actually, a good, good documented case report to start the examination should be enough on a 1 to 2 A4 side. So please do not bring us whole books and pictures. 500 words. 500 words. Yeah, 500 words. So a little voice in my ear is telling me 500 words. Okay, thank you. Physiotherapists. Okay, let's how long should case report? We answered this already. And then the last question, thank you for putting these questions. Yes, we had already participants outside of Europe, and we welcome every participant and people who are interested to take our examination. And you can, you're welcome to take our examination. If you're in doubt about your background and your baggage and luggage in pain medicine, please contact us and we can discuss this also if it's reasonable, fair to take this examination. But we welcome from Asia, South America, Northern America, Africa, and from down under. So no problem to take our examination, you're eligible. And in this case, I think that's a very nice wrap-up. So I've got a few messages from participants of the webinar thanking us and thanking me and the whole team here in the back office to support this webinar. I wish you a very pleasant evening. I hope this was very helpful for you to take a decision. And if you're in doubt and you want to discuss your background, no problem, take contact with us. Finish your registration in time if you want to have financial support. And otherwise, we hope to get your registration by March the 30th. And I hope to see you live in the city of Leuven, April 12th and 13th of this year. Thank you very much indeed, and I wish you a pleasant evening. Bye-bye.